name is Josie Montegaard. I'm a nurse practitioner at Dana-Farber Cancer Institute in Boston, Massachusetts. I work in the lymphoma department at Dana-Farber, and I've been in my position for a little over 7 years now. I'm really excited to be at JADPRO Live this year. I've seen some really amazing talks already. Just this morning, I think one of the most interesting talks that I saw was on dermatologic toxicities. So many of our new medications in the liquid tumor side and the solid tumor side have dermatologic side effects. And it was so interesting to hear how these derm NPs are managing these side effects on their own, independently in their clinic, and just really being a resource to the oncology teams. I know that's one of the things that I struggle with when I see a rash, as to what to do about it, and doesn't mean that I need to stop the patient's cancer treatment. You certainly don't want to do that if you don't have to. So it's really nice to get some tips and tricks from them to figure out how to troubleshoot some of those side effects. Outside of that, I think that this meeting has just been such a nice community building experience. I look forward to this meeting every year because I think it fits the needs specifically for APPs. We have other nursing focused conferences that focus more on infusion nursing and oncology, nurse navigators, and then we have ASH, which focuses heavily on the medical side of treatment data. But I think the APP focused conference like this has just been so nice to sort of mesh the two of those, where we're focusing on nursing care because that's truly what we love to do. But we also are managing these patients independently. So we need to be aware of the data when patients ask for it or ask why we're doing a certain thing. We have that medical background where we're able to support our decision making. And outside of that, I've been coming for a few years now, and it's so nice to see familiar faces of other APPs, both working in a similar department as myself, but across the nation, and then other APPs that aren't even in lymphoma, but I've just met through these conferences. And it's nice to have this sort of global or national support network where we can meet and collaborate on ideas. I was just thinking about how it's so nice if I am curious about what my colleagues are doing at other academic centers. I have their emails now where I can just send a quick email and ask them, how are you doing this, or what's going on at your institute, so I can bring that back to my institute and help better our practice and, standardize what we're doing a little better. Another thing that I think is really great about the JADPRO conference is it brings together people that are working in the academic centers as well as the community-based clinics. And I think that that's a conversation that's not always easily had. When I am working in my academic center, often I'm speaking to other people that work in other academic centers, but there's not as much outreach that I have to even some of the local community sites. And I think it's really important to be able to meet those APPs and have conversations about what it's like working in their center versus ours, and what we can recommend as, why don't you try this at your center, or see if it's something that you could make available at your center, and also understand what the challenges are in the community, because we share patients. I often have patients that will come to my center to get an idea of what they should do for their cancer treatment, but they want to get treatment close to home with a local oncologist that they're comfortable with. So it's nice to actually meet the APPs that are going to be actually providing that care, and just establishing a relationship in that way too.